So good evening, everybody, and we are so happy to begin our Vaccine Week Part 2. It has been great to meet with people again and get this out. We know there's a lot of information around COVID and the vaccines that people should know, and we want to make sure that we stick to our commitments of making sure that we can provide accurate and up-to-date information so that our residents, our community members here in New Brunswick can make decisions based on sound, accurate information, right? As they consider what they want to do with COVID, and especially, hopefully, get to the point where they're going to get vaccinated for those that are not vaccinated. And so we have a lot of topics that we're going to be covering this week. But before we get into that and the topic that we're going to cover, today, I want to welcome my partner in crime, as I call her. We all, Mariam has been a stout supporter and partner with respects to anything community health, and obviously in her affiliation with the hospital, but I know that she does this also from the heart. So Mariam, thank you so much again for being part of Vaccine Week. We're back again, which is great.
We're back again.
Great and not great.
Thank you, Manuel, and it's a pleasure to be here in our second Vaccine Week, and it's so important that we keep this momentum of giving people the accurate information, timely information around COVID. We started this at the beginning of the year to make sure that people had, like you said, the right information to make the best decision for themselves and their family, especially now their children, right? This is the new thing that we are going to be covering throughout the week, and make sure that we are making sure that we have trusted individuals from our community physicians are going to be with us throughout the week, to make sure that they are familiar faces, that is people that the community can trust, that they are from those familiar places that they go to get their health care and the health care of their children. And today we have Dr. Rick Marlink, that is the director of the Global Health Institute at Rutgers. So we are so happy to have you here, Dr. Marlink. This is a pleasure for us to have someone that have that global perspective on health and end up in a place like New Brunswick, and you can share your expertise with us. So thank you so much for being with us today.
Thanks, Mariam. Thanks, Manny. Mariam, I don't know if I've told you that your first name is one of our favorite names in our family. My wife's mother was named Mariam, and so we named our daughter also your same name. So
thank you.
Thank you.
That's great. And Mariam, I just realized that we didn't introduce ourselves. I'm so excited about getting this going that
what's going on?
Forgot to say, not a lot of people know who I know a lot of people know who Mariam is, and but we could live without that. But just to be fair, let's introduce who we are so people know who we are. So Manuel Castañeda, Director of Community Health from New Brunswick Tomorrow. And Mariam, do you want to introduce yourself so I don't mess it up?
Yes, I'm Maria Merced, Director for Community Health at Robert Wood Johnson University Hospital.
Okay, now we got through the formalities, right? Let's get into the nitty gritty. I will want to say that I want to definitely give a shout out to the Institute for Global Health. They've been really great partners throughout the pandemic. Helping organize and coordinate COVID testing sites here in the city, mainly the one downtown. As well as COVID vaccine clinics in the community. And so we thank you. I know that the community thanks you for those efforts.
Well, we're all doing it. It's not us. It's a partnership with New Brunswick Tomorrow, Robert Wood Johnson, and all the New Brunswick partners. It's great.
Great. So let's get into this, right? So we want to talk about boosters today. There, a lot of people are still very, it's relatively something that's been around now for a bit, but at the same time, it's been evolving, right? And so people are still very, confused or might not understand completely what boosters are. But prior to getting into that, can you just give us a brief summary of what vaccines are available, just so that we can put it in better context for people?
Yeah, well, as you know too, there's still the three brands, 3 types of vaccines that are approved in the United States. The Pfizer and Moderna, those are the 2 company names. And so the vaccines are, they just use the company to describe or to name the vaccine. They're 2 doses, separated by several weeks. And it's a certain type of vaccine called mRNA. It's a new type of vaccine, but it's been tested in other settings, other diseases, and all these are tested extremely safe. And then closer to home, the headquarters of Johnson & Johnson's in New Brunswick, we have the J&J vaccine, which is a one-shot vaccine and uses, again, a tried and true platform, as we call it, or a technology that has been used for many, many other vaccines. So those are still the same 3, and they're available in lots of different places, and they all work very well. There's some of them that aren't, you'll hear about. One might work a little better than the other, but all 3 of them really work head and shoulders above a normal or a regular vaccine setting. If we usually have vaccines work, like a flu vaccine might work 50% of the time, meaning it works, but it doesn't totally prevent flu. Only about half the time it might help you prevent flu. But we still we use the flu vaccines, and they're really effective in reducing flu and its transmission. These are way up in the 80-90% effectiveness ranges. So they're really good vaccines.
Great. And so, like you mentioned, the Pfizer and the Moderna are 2 doses, right? You get 1 dose, and then you get a following dose after a certain period of time. The J&J shot is a 1 dose. But now we're hearing about boosters, right? And people are like, well, first of all, what is a booster?
Yeah, a booster is, another shot of the vaccine to boost your immune system up to a higher level of immunity protection against the infectious disease, in this case, COVID-19. So it's a way to sort of, you've got your immune system running by getting a vaccine, whether it's the 2-dose Pfizer or Moderna or the 1-dose Johnson & Johnson. Your engine's started. It's ready to, fight off. If you're going to be exposed to the virus, it's ready to fight it off. It's a way of really boosting your immune system, like revving your engine up to a higher level, so that it's really sensitive to fight off the virus. It's used in other vaccine situations. It's not unique for this infection or this vaccine. Like you get a tetanus shot, you need it boosted after, as Miriam knows, after 10 years, you still need to boost your immunity. Your immunity lasts a long time for tetanus, but it slowly, your engine slowly goes back to idling rather than running fast against the infection or being ready for the infection. And you want to boost it again to rev up your engine against the infection. So that's what boosters basically are. They're not, they're the same preparation. It's just your immune system's ready to fight off infection, and it gets another boost, as it were, with this artificial vaccine that sort of says, okay, this is going to start your engine even faster, and you'll be more prepared against infection.
I think that those points are so important, Dr. Malik, because many times when recently, right, with COVID and people hesitation about the vaccine, when they hear now boosters, it's like, oh, it was never effective, right? Now you have to take a second one, and God knows what we're gonna have to do after that. But they don't remember what you just said, that many other vaccines go through the same process, and we've been getting boosters all along. I have gotten a lot of boosters along my life, my children, right? So I think so important that you explain that we are teaching our bodies and our immune system to act again, right? To get that full protection as we do the boosters.
Yeah, yeah.
Yeah, and I think, yeah, you know, it's important to note that this is no different than any other vaccine, right? Because I think a lot of people also think, oh, well, look, you know, it's not working because, you know, or it's not effective. We've heard that a lot in the community. Why do you, if you need another shot, that means it's not working. But I think it's important to point out, like you mentioned, that, you know, that this is following the same pattern that most vaccines do, right? That eventually you do need to get another dose. I mean, you mentioned the flu vaccine, right? I mean, that's something you have to get yearly. And maybe we're, you know, I know that there's been at least some talks in the medical community saying that, you know, COVID might end up being something like that, although it's not there yet, right? But this is not anything out of the ordinary for vaccines, correct?
Correct. Yeah, it's not out of the ordinary. It's that the, you know, COVID and the class of viruses, it's a respiratory virus. You know, it spreads by us breathing and coughing, and it is very contagious, you know, so that's probably why we really need to boost our immune system sooner rather than 10 years from now. You know, the tetanus virus is less contagious, and you don't get it by breathing it in. You might get it by you know, breaking your skin or something. So it's a different situation, but it doesn't mean it's different than the other vaccines or other situations that you need to get your immune system boosted against the virus.
And I also, it's important to say, to mention that the idea of doing boosters comes out of the data of what it has been seen of the effectiveness of the vaccine, right? From the beginning, now they are monitoring the millions of people that had the original 2 dosage, and based on that information, that data, they're making these decisions, correct?
Correct. Yeah. Yeah. It's not in a vacuum. And we, there's so many people now that have been vaccinated, and we can follow them and see really what's the best way to go on boosters, and when do we think a booster is necessary. So now we know, you know, after about 6 months, you probably should go in for your booster at this point. Do we know what's going to happen next year? This is a new virus to people, so we really don't know what's going to happen in the future. But you know, I think it's these things, these vaccines work so well. And the boost raises your immunity many-fold. It's not just like doubles, you know, like if you got a second dose, it's not like saying, okay, you got twice as much now protection. It really raises it many-fold. So it really, really gets your engines going at high speed, and the engines of your immune system against this virus. So we don't know what the future, how often we're going to need boosters, if at all, but certainly it's encouraging that they're working so well, and it really raises your immunity many-fold against the variants. And we might want to talk about variants. I don't know if that would be on the topic, but it does show the boost may be very important for new variants that are coming or circulating in the world. The one that we have around the United States and most of the world now is called the Delta variant. Again, they just named them after Greek letters to make it simple rather than some complicated number or some genetic code, but they just said this variant's called the Delta variant. And that one, you know, the vaccines are effective against, and the boosters help against. There's the Omicron, a new variant that's been described that we don't know what its future holds, but it may be more infectious. But still, having a booster has been shown early on now that it probably helps against this new variant also, especially if you have a booster. So I guess over time, we're just going to keep following the millions of people around the world, see how they do in studies and see how to best recommend boosters or how often boosters should happen.
And
That's
I
a
know,
great point.
Yeah.
That's a great point that, as we see, things develop, especially with this Omicron, we have to be making sure that we're making the right decisions, right? For ourselves, for our family, because this is not over yet.
yeah. So Dr. Marlink, I know that you mentioned that, it's that the time to get your boosters is basically 6 months after your second shot. And that's for the Pfizer and the Moderna, correct? The Pfizer Moderna boosters?
Yeah.
But it's different for J&J, am I right?
Yeah, you can get it sooner with the J&J at 2 weeks, and you have 2 months, sorry, and you have you call it a booster. The J&J was originally just one shot, so I guess it should technically be called a booster because it's done a couple months later. But again, it's the same principle. It's just gets one shot is good. 2 shots is better. Probably 3 shots is going to be better. That would be the booster for the Pfizer and Moderna. But yeah, J&J and all 3 benefit from a booster. It's just the timing is different.
Right.
Yep.
And then when we talk about boosters for who qualifies? So let's say you've got Pfizer, or you've gotten Moderna, and you've gotten through your second shots, you've waited your 6 months, or you've gotten J&J and you waited 2 months, and now you're ready, at least in that aspect, right? But who right now is eligible for a booster once they satisfy those requirements?
Well, now it's much simpler. So everyone 18 and older qualifies for a booster, is recommended to get a booster if that timing is in place. You said either 6 months or 2 months. So before we worry, we obviously want to protect the most vulnerable first. And so we had it for the vaccines also. So we had older people, getting vaccines first. Those that had other disease conditions or were immune compromised, those people get the vaccines first. And for boosters also, but now the boosters are both so available and proven to be so useful and safe that it's recommended now for everyone 18 or older can get a booster and should get a booster.
I think that the biggest questions about the boosters that we have seen has been around mixing the vaccine, right? If you had Moderna, the first time you had the vaccine, the 2 dosage, should we get Pfizer then, or should we keep with Moderna? I think that we see a lot of concern and questions about that. They really, I'm not sure if that's something that can be done or something appropriate to be done. If you're doing it with your seniors, people that has compromised, immune system. Can you go over a little bit around that?
Yeah, that's a good question or a good discussion area, because we didn't know at the beginning, should you change your vaccine type when you get boosted, or should you stick with the same type that you got vaccinated with? Pfizer, and you should get boosted with Pfizer, or J&J get boosted, Moderna get boosted with Moderna. But now again, this is the advantage of research and people following people over time. The recommendation is you can get boosted with any of the boosters, any of the vaccines, no matter which one you started with. So now it's more convenient because all seem to boost, give you a several-fold boost. I think over time we'll learn even more about how to do that better. But the recommendation is pretty clear, is that just getting a booster doesn't have to match your original vaccine. It's go ahead and get a booster that's available and convenient. If you want to, you feel like, well, I'll get the same one because I know I did okay with it and I want to stay with the same one, fine, stay with the same one. But the best vaccine and the best booster is one that you actually get, one that ends up here in your arm. So if it's delayed or some reason you don't get it, of course, you have your own choices and it's up to the individual, but the best one is the one that you get and you get on time. And but again, it doesn't matter which the booster, it doesn't have to match your original vaccine.
And I must say that the healthcare system has been very flexible. You can go and you ask, what's available, and they even ask you which one you want, right? Which deals a lot with issues of access, right? That you can go and expect to get whatever is your choice to get. And I think that it's always good when you can get the choice that you have, right?
Right.
So I think that has opened, access issues that we had in the past regarding the vaccine. So that is very good to know that, it's okay. You can choose which one you want.
Yeah, and you shouldn't be afraid to just grab whatever's available too, right? That there's no need, if for some reason you got Moderna, but all they have available is Pfizer for some reason, right? That's okay too. Of course you have the choice, but that's okay.
Yeah. And as we research this again, it might even be better to switch to another type. We don't know, but we know that it doesn't hurt, and it gives you a great boost no matter which one you get. But in the long run, we'll find out even more of how to do this better, and we'll probably have other vaccines that'll be approved too, and those will be helpful to know about. But yeah, the flexibility is there to get whatever one is available or whatever one you choose to get.
Great. I think another question we've heard a lot from the community is, okay, so I need to get a booster, fine, but am I going to get side effects? What should I expect, right? And I think, so what do you say? What do you say when somebody asks that? I know, because we get that a lot.
I don't know, Miriam could answer this too, but I would say, I usually say you should expect side effects because that's the side effects would usually tolerable, would go away in a day on average, but you should expect that your immune system has now been revved up. I like to use the engine example, but it's basically the vaccine is doing its job by letting your immune system know this is what you want to fight off. This is what you're seeing now, seeing down on the cellular level, that it's in your system. And what you're seeing is what you're going to fight off. So the immune system starts to get ready to fight something. There is no virus. You don't get infected with the vaccine, but your immune system is starting and to get starting its engines. And so you feel like you might have a little flu, or you might feel, tired. You might have the other side effects, as we call it, but it's basically some of the side effects of feeling like you have a cold or you're run down. Your arm may be a little sore. Again, your immune system's starting to say, oh, there's something here. I better send some white blood cells, and try to fight off. There is no virus, so it ends up going away. Your soreness goes away, and you end up, it's a very temporary side effects. Some people, though, don't even notice that they got it. And those are maybe the lucky people. It doesn't mean it didn't work. I remember my first dose and vaccine, I kept thinking, did they have anything there? Did I get something? Because I feel fine. And my other family members, they had some side effects, but I'm immune, or I have the vaccine worked. And the second time I did have some side effects. And so I don't think you can predict from time to time either. I don't know. What do you think, Miriam?
I think that every person is different, right? It's an individual reaction. What we have seen personally, I had no reactions to the first two, and I had a little bit of more reaction to the boost. But nothing compare, you know, I had COVID and nothing compares what I went through when I had COVID. You know, so I feel secure using the vaccine. So, you know, I have my 88-year-old dad living with me, and we have to make sure that he's okay. And he didn't have any side effects on the first one, a little bit more on the third one, but nothing compared from when we were all sick. And I think that's a great point that you bring. And I like the idea of the engine, you know. We, at the beginning, when we did this the first time, we said that, you know, it was like, you know, a military exercise. You practice the first time, right? We're doing all the exercises. And then that second shot, you will go in a war, right? And with this one, again, you are now practicing again to make sure that you have all your bases covered.
Yep.
Yeah.
And I agree with you, Miriam. I had the same experiences. I also had COVID, as you know.
I was going to ask you, Manny. Yeah, go ahead.
Had COVID as well. That was not fun. And I did have a bit of a side effect for my second shot. I got Moderna, but nothing compared to the 2.5 weeks that I had to deal with COVID. So trust me, you don't want to do that. So if you can avoid it, get yourselves vaccinated, get yourselves the booster. You'll be better for it in the long run. Just one final question, Dr. Marlink, and that's something that we've been also hearing is, you know, especially during this time, you know, there's also, you know, a lot of promoting of the flu vaccine, right? This is the time that people would get the flu vaccine, but some people are concerned, like, can they get both vaccines? You know, is that an issue? Is that something that they should avoid, or is that okay?
That's a good question, and that's a good concern, but it turns out it's okay to get multiple vaccines at the same time. And the one that's you might think of as, well, maybe I better not get them at the same time because they're both against a respiratory infection, flu or COVID. But it turns out it's okay. And it's probably good to go ahead. You're already sitting there getting your vaccines. You got one vaccine, might as well get the other. Because again, this is winter time. This is the time where you want to be protected against both. And you don't want, doesn't mean you're not going to get sick, but you know that you're protected then against COVID and against the flu. And those are two can be deadly infections, but also ones that you want to be protected against. So you can get them, you can get vaccines at the same time. And again, that's been looked at and researched. But the one other thing, Manny, that this sort of brings up is that, you know, we're not just protecting ourselves when we get vaccines. You know, we're really protecting, as you mentioned, as Miriam mentioned, her older mother, we're protecting our loved ones around us. We're protecting our neighbors. We're protecting maybe the old person that we don't know, but if they got infected with the flu or COVID, you know, they could succumb to that infection. So we're really protecting our neighbors, our community, and our family. You know, yes, the younger folks are more likely to, you know, be able to be sick and they'll recover. But if they were vaccinated, they won't spread it, you know, to their loved ones, ones that may have other health problems or the older people that really can't handle this infection.
Yeah, that's a great point, Dr. Marlink, and something that myself and Miriam have been talking, right? That if you don't do it for yourself, you know, and it's a personal choice, think about others that it could affect, right? That not only are you protecting yourself by getting vaccinated, but you're protecting your family, your loved ones, especially those that can't get vaccinated. And, you know, I think we all have a commitment to our community, our family, our friends, you know, our neighbors. And so the more that we're all protected, I think we're all better for it. So yeah. I think that's a great point.
Yep. Thank you.
Yeah. Thank you so much, Dr. Marlink, for your time, for your expertise, and for the Institute's continued support of efforts here in the city of New Brunswick. Miriam, we have finished day one.
Yes.
Day one. We still got, we got, you know, 4 more days tomorrow, just so everybody knows. We'll be covering vaccines for the pregnant and for those in postpartum. We'll discuss fertility concerns, and we'll also discuss long-term COVID effects. And this is really about people who've had COVID but still feel something even long after they've recovered, whether it's chronic fatigue. But we'll get more into that tomorrow. Today, again, I just want to thank everybody, and I want to say that we're again very happy to be here, and we'll see you every day this time.
I just want to say that at 7 o'clock, join Live Well, right? And at 7 o'clock, at 6 you join Live Well. At 7 o'clock you join Su Salud for the same program in Spanish.
Right. So Live Well does the English version, and then either Live Well or Su Salud, whichever you prefer, you can go on to the Spanish. But we're going to be broadcasting as much as we can, as many times as we can. So again, Dr. Marlink, thank you so much. Mariam, I will see you tomorrow.
See you tomorrow.
Thank you both. Thank you both for all you do. Thank you.
Bye-bye.